Robin, Mary, can you hear us?
Yes, we can hear you.
Oh,
Can you hear me?
fantastic. All right, we are
Okay.
rolling. Well done, everyone.
All right.
Okay, we are going to refocus back in on item three, the West Side Regional Behavioral Health Services Strategic Roadmap, and we have our consultants here at Capstone Solutions on and ready to present.
We are ready to roll. Are you going to share my slides or shall I pull them up?
We are sharing your slides. We
You're
are sharing
sharing.
your slides now.
Okay, so let's go ahead. Again, I'm Dr. Robin K. Wicker, one of the partners in Capstone Solutions Consulting Group, here with my colleagues, Cassandra Faturos and Mary Marks. And we're delighted to be with you today to share an update on the project that we are collaborating with the cities in order to do. Bear in mind that today is an update only, it's a status report. There is another phase to this project where we will actually be delivering recommendations and final observations. But today is very much a status report. So let's go ahead and advance the slides. And I will tell you that because this is a little bit lengthy and I know your time is tight, I won't speak to every slide individually. Some of them I'll just refer to and let you take a look at them and direct any questions to us at a future time. So next slide. So what we're here to do today is to give you a little bit of background on the collaboration with the COG, update you on the current status of our project, provide you with a summary of what we have found to date in terms of city-specific engagement and themes, and then very quickly, if you have time, answer any questions and entertain comments. Next slide. Next slide. Oh, here we go. Okay, so just most of you will remember this, but the current project, the Behavioral Health Continuum of Care project, is an expansion and an update of what the project that we previously did for the city of Santa Monica. The purpose of that project was to focus on existing intensive behavioral health services that currently existed in Santa Monica, later expanded to Service Planning Area 5, the entire West Side, exclusive of West Hollywood, of course. And to present some key findings, which we did, we made, next slide, if you can do that. So we made several recommendations to the Santa Monica City Council. This goes back over a year ago now, related to what we saw as a lack of capacity or limited capacity in certain key areas. Those included expanding the urgent care center, which was always at maximum capacity. And the key finding from that initial project was that the West Side lacked sufficient substance use disorder treatment programs in order to meet the needs. So there's actually been a lot of work since the time that we issued that first report. First of all, we're delighted to update you and let you know that the Exodus Recovery Urgent Care Center, through the great efforts of the City of Santa Monica, in collaboration with the County Department of Mental Health, is moving to a new location, is expanding the number of beds, which should enhance access. It previously, and actually at the present time, the West Side Urgent Care Center commonly was at maximum capacity, sending residents of the West Side as far away as East Los Angeles to receive care when they were in a mental health crisis. So this should alleviate that backlog quite sufficiently, we hope. The Department of Mental Health is adding full service partnership capacity. That was a key focus of our initial Santa Monica report, looking at full service partnership slots, which are full service partnerships are 24/7 wraparound programs for people with the highest level of behavioral health need. And then again, building on the observation that the West Side was had some serious challenges related to substance use disorder treatment, we were happy to learn that Claire Matrix was the recipient of more than a $50 million grant, infrastructure grant from the state of California, which will it will establish a capacity for detox beds and withdrawal management services outside of emergency rooms for the West Side. It will expand residential treatment beds in a very substantial way, 75 new beds, as well as enhance the outpatient treatment capacity. And we'll come to this later in the presentation, but those of us in the behavioral health field know that when we have individuals with substance use disorder problems, it's key to be able to offer them treatment at the time that they seek it, because otherwise there's a danger of relapse if treatment is delayed. Next slide, please. So quite a lot is happening. So what was the scope of this expanded project? First of all, to update information about intensive behavioral health services, because after all, our initial look at what existed in Santa Monica and the West Side is about 2 years, a little more than 2 years old at this point. This time to include the city of West Hollywood, which wasn't in the original project. Expand our exploration to include crisis response, which was just developing when we did the initial project, as well as peer support. And this time to do a deeper dive into the strengths, needs, and challenges and opportunities for each city, which was not a focus of the initial project. Our deliverables, again, to update the capacity of Service Planning Area 5 in West Hollywood, to do key informant interviews and surveys so that we had a deeper and broader set of information in order to identify themes for each of the cities, and then finally to make recommendations. Next slide, please. So where are we now? I won't go through this in any detail. We are now in phase 3. We're just wrapping that up. We've completed our interviews with the city representatives in West Hollywood, Culver City, Beverly Hills, and Santa Monica. We have interviewed all of the key informants that were recommended and suggested to us, and we have administered a survey. I will tell you that is still in process. We've had some late participation, so we're not completely done with the survey, and that's why the status is partially completed. Once we have all of the information, we will put it all together, develop a Westside Behavioral Health Regional roadmap for you with recommendations for opportunities to strengthen the behavioral health system of care, tempered by recognition of the political and funding realities that exist at the current time. So I can tell you now that our recommendations will include near-term, fairly easy to implement or suggestions and strategies that can be done in the near term, and those that will require more time and funding. Next slide. So where are we right now? Next slide. I'm not going to go through this in any depth. You can look at it later, but we did the same analysis for West Hollywood that we had done for the West Side previously, looking at existing capacity, where there was significantly limited capacity or no capacity, and focusing also on the processes that knit together the system, which are quite honestly as important as the structural capacity of each regional area. Next slide. Our key observations with regard to the substance use disorder services, and again, we're highlighting this because of the importance of those services in Santa Monica and SPA 5. Again, no surprises that often residents of the area must seek treatment, sometimes at quite a distance from West Hollywood, and that there's a heavy reliance on case managers working within the existing programs and the city-funded outreach teams to provide the linkage between the services that currently exist. Next slide. So what are the city-specific and common themes that we found so far? What have we learned? Overall, one thing that we want to stress, and this was, we kind of knew it, but it was significant and impressive to us. Each city has made significant investments in behavioral health services, particularly in outreach and engagement. And crisis and outreach. Although they look a little bit different in each city, nevertheless, if we were to summarize what has impressed us the most, it's the dedication of each city individually in ensuring that residents have access to timely behavioral health crisis services when residents are in need. And so we've detailed what those services look like in each city. Next slide. Nevertheless, there are also some common challenges. So when we interviewed the city representatives, we uncovered two levels of challenges. The first we would describe as structural. What are the programs? What are the actual, sort of brick and mortar programs that exist on the West Side? A common finding was that there's a lack of a level of care just below locked facilities like inpatient units when people need a fair amount of structure, are not ready to return to independent living in the community, but don't meet the criteria for being placed in a locked facility. There's just a lack of residential treatment that would meet that level on the West Side. Inadequate access to timely substance use disorder residential care, although with the expansion of Claire, we expect that will change. And also, although this project, based on the recommendations stemming from the original project, is not focused primarily on the needs of unhoused individuals. The recommendation was that we focus on the intensive behavioral health needs of all residents of the West Side. Nevertheless, we do include special consideration of the needs of unhoused individuals. And there's a recognition that they're currently, and this slide may need to be wordsmithed a little bit, it's lack of a residential treatment facility that addresses the design and program desires of unhoused individuals. So that's a little bit different. But we also found that there are some functional challenges that even though there's a plethora of crisis response teams, oftentimes, particularly when the teams do not have the ability to write an involuntary hold on their own and must wait for county staff to arrive on scene to write an involuntary hold, a 5150 hold, and transport individuals that need to be hospitalized, those wait times can prove extremely problematic. Similarly, when there's a need to engage staff between city and county teams, not just necessarily for crisis response, but it could be for outreach and engagement. There are often delays that result in clients not receiving timely access to the services that they need. And then coordinating care among different systems. So, for example, mental health, substance use disorder, health, housing, and other kinds of services, coordinating care between those different systems for clients with complex needs can be cumbersome. And there's no real clear navigation pathway for doing that. Next slide. I'm only going to highlight a couple of bits from each of the key informant interviews in the interest of time. For Beverly Hills, we did note a very strong coordinated crisis response infrastructure, but a persistent gap between short-term crisis stabilization and long-term treatment capacity. Vulnerability, strength at the front end, but vulnerabilities in the downstream capacity to serve people or to make sure that people who received crisis visits were served in a coordinated and ongoing way. Next slide. For Culver City, again, an excellent crisis response capability, really fantastic, wonderful coordination between fire department, police department, and crisis response. In Culver City, a fair number of providers that deliver full service partnership programs, but not always timely access to those slots. And then some gaps for high acuity populations. We found this in Culver City, but it's really true of all four cities. There are very strong informal relationships, and those informal person-to-person relationships often make things work in lieu of formal networks that drive access to care. Next slide. In Santa Monica, a very, very strong commitment on the part of providers, everyone, in terms of wanting to make things work. Again, the personal contacts and informal coordination support, successful client care, strong crisis response infrastructure with different kinds of configurations of teams, and just an observation that particularly in Santa Monica, and I think this is probably true everywhere, that we're seeing increasingly acuity and complexity of behavioral health needs. Next slide. And then West Hollywood, again, same thing. Strong commitment on the part of the city, very strong crisis and outreach services. But surprisingly, fewer behavioral health services located in the city of West Hollywood than we might have suspected at the outset. By the way, we have geocoded services for all of the four cities as well as the West Side overall, so that when we issue the report, you'll be able to see what it looks like and what the distance is between services. And again, care coordination that works best through relationships. Next slide. I'm going to skip this because I think I've pretty much highlighted it. The only thing that I will call attention to is that, interestingly enough, every city has specific populations of concern, and they're not the same from one city to the next. You probably knew that, could have guessed that, but we found it quite interesting. Next slide. Okay, so we finished the interviews. We are now in the process of collecting information from the stakeholder survey. At the time that we did this PowerPoint, so that we could get it to you a little bit before the presentation, we had 29 responses. We now have 63 and going up. There's like a last minute surge. So this will need to be updated. But significantly, the responses that we did receive were from a very healthy array of respondents. People representing mental health, substance abuse, emergency medical services or crisis response, law enforcement, healthcare, housing and supportive services, education. So even though we didn't have as many initial responses as we had hoped, yet the responses that we did receive are from a very healthy cross-section of the entities that the city representatives were hoping we would reach. So that was positive. Next slide. And we'll actually skip the next one and go right to the next one. So in terms of the survey, and again, this will be updated, so I'll just speak to it quickly. What's working? No surprises. It validates everything that I just told you from the key informant interviews. There's a very strong, dedicated frontline workforce on the West Side. There are sometimes workforce challenges in terms of recruitment and retention, but not as much as in other parts of the county. So the workforce is dedicated, and most of them have been working in this field for quite a long time. We do have some peer-based models. We'll get into that when we make our final recommendations. They do work, but they're not very well known or integrated into the system that currently exists. And extremely impressive collaboration, particularly during crisis response. Almost done. Next slide. Challenges, I won't go through this, mostly the observation that fragile transitions and coordination of care, particularly across systems, and unclear navigation pathways. Next slide. And then we did get some recommendations. These are the three that were most obvious. The desire to increase local capacity in mental health and substance use disorder services, even though on paper it looks like there's a fairly good array, yet the access is sometimes challenging because there's just so much need. A desire for a lot more information about how to navigate the behavioral health system and how to navigate across systems. And then, of course, low-cost housing and recovery support options, some of which are in process. And I think that's the last slide.
Thank you.
So I'm going to conclude there.
I know today's not an action, it's not an actionable item on the agenda, but I want to make sure that any of my colleagues have a chance to ask any questions or comments. And we do have a short amount of time, so we'll move forward pretty quickly. Anything else, Riley, on your end? Okay. Any comments or questions? I almost called you mayor, so Director Nazarian.
Well, thank you very much for the presentation. I appreciate it. Obviously, we know that homelessness does not have city borders, and we appreciate working together with all of our neighboring cities. There was a shortage of trained personnel in the mental health field. Has that issue been addressed at all? Was that looked at in providing supportive care?
So we looked at the capacity issues related to full service partnerships. That's where we would see challenges with recruitment and retention surfacing. It happened in the Santa Monica report. We noted that although the Department of Mental Health had contracted for certain numbers of slots, some of the agencies were not able to fill all of those slots because they didn't have sufficient workforce. That seems to be less problematic right now, although it isn't completely resolved.
Good. And then my other question is with regard to outreach to businesses, oftentimes we try to or do outreach to those that are unhoused. However, when they're on private property, especially overnight, and we have social services going out to provide services, they can't really approach them because they're on private property unless there is agreement with the business that they would have access to that. Has that issue been addressed at all?
It hasn't. I can't say that it has because the focus here is on the capacity of the behavioral health services, not the legal issues that occur related to access to private property. But we'll take that question under advisement and discuss that further with the
And I know that we have a shortage of time, but I had one other question. For us and for the city of Beverly Hills, seniors are among the most vulnerable individuals that are being impacted. Is there a reason why that was not included in the report?
Well, bear in mind that, and I'd have to go back to the slide on Beverly Hills. This is a status report on, I'm not sure if you're asking about the populations that were highlighted by the cities.
Yes.
Maybe it was that slide. We took what, yeah. So this is an update. This is from the input that we received from the variety of stakeholders that we interviewed or the survey responses. It doesn't limit us to looking only at those issues when we do our final report. I think we noted that there were different populations of concern, and truthfully, older adults who are quickly increasing in percentage of the population are a key issue, I think, actually in all the cities. So we may not have highlighted it because it's a cross-cutting issue, but we certainly can in the final report.
I appreciate that.
Robert, I'm just.
Oh, sorry, Cass, go ahead.
Sorry, I just wanted to add, I think in this presentation, we were trying to highlight themes. And so that doesn't mean it didn't come out in the interviews or in the survey information. We just highlighted because we had so little time. So more robust information could come out in the final report as well.
Thanks, Cass.
I'm just referring to the common themes, key informative,
yes, key informative
interviews. Yes. So if we could just make sure that for our city, we have a very large aging community, and they are the most vulnerable in this position, as well as young families. But I think we're more concerned with our aging community, and we want to ensure that they have the resources that they need. Thank you so much.
Okay, the other thing I want to just go back to for a second is about workforce capacity. The one thing that we did find, both in the original report and to date, is that the capacity for accessing psychiatry, which is one of the key services for people that are in need of intensive behavioral health services, was actually quite robust on the West Side. And so that is not a workforce issue. That exists insufficient supply.
Thank you. I'm going to see if there's any comments or questions from the directors from Culver City or Santa Monica or the county. No? Seeing none. I thank you so much for the update on this report. We know there's still so much work to come, and we appreciate your update here today. I'm going to move us forward then with item 4, action items. Seeing no concerns from staff. Terrific. We have a number of action items. I'm going to move us swiftly forward on, starting with the approval of 2 different meeting notes, the minutes from December 11th and February 12th. We decided to skip the approval of December 11th because we had a very new set of voting members here at the COG. So that is why we have 2 today. If there are any issues or seeing none, do we have a motion to approve the meeting minutes?
Take them separate.
Yeah, we can take them separate. So we'll do the meeting minutes for December 11th first as an approval. Do we have a motion to approve?
Motion to approve.
And do we have a second?
Second.
Okay. And can we do a roll call vote? Or I guess we can just do by seeing no opposition. Okay, great. A vote of acclamation. No objections? All right, December 11th approved. We'll go to meeting minutes from February 12th. Do you have a motion for approval? Thank you. From Santa Monica? Okay. Culver City and Santa Monica. Thank you. And we'll have an abstention from Beverly Hills.
Thank you.
Otherwise, all in favor? Terrific. Meeting minutes approved. We'll go to item B, Homelessness Measure A Local Solutions Fund. I'm going to turn this over to staff for a presentation on the fiscal year 26-27 COG allocation.
Okay, Ana Cuevas Flores from our team is going to present on this item.
Great, thanks everyone. Hello, good afternoon. So I'm here to sort of present on the Homelessness Measure A Local Solutions Fund, specifically the fiscal year 2026-2027 WSCOG allocation. So we hope to have the board authorize our staff to finalize the statement of work for fiscal year 2026, 2027, and then submit it to the county for inclusion in the contract. So next slide. So I'll begin with just a quick recap of background on Measure A LSF. I know we've discussed this in back last year, but quickly, in November of 2024, LA County voters approved Measure A, and this allowed cent countywide sales tax dedicated to addressing homelessness through affordable housing, prevention efforts, and renter support. At least 15% of Measure A revenue is allocated to the Local Solutions Fund, which distributes funding to cities, including Council of Governments and unincorporated areas. So the county adopted an evidence-based formula back in March 2025 for allocating these LSF funds, which incorporates a multi-year average point-in-time homelessness count, as well as data on student homelessness from the Census Bureau. And so again, that formula is being also used for this 2026-2027 funding allocation. So we go to the next slide. In terms of just quickly reiterating some of the eligible uses under LSF, these fall under Group 1. Again, these are really catered towards homelessness prevention and homelessness intervention, specifically around permanent housing, moving folks from interim housing to permanent housing, and expediting some wraparound services, including employment services and specific services for at-risk youth and children experiencing homelessness. Last year, a lot of the LSF funding from all the cities went towards interim housing, specifically to move people into permanent housing. So we go to the next slide. For fiscal year 26-27, Santa Monica will receive about 1.3 million. They will also be doing this through a direct agreement with the county. Santa Monica also had this direct agreement with the county last year, so that will continue through for this next fiscal year. And then the COG will administer a total of about $730,000 on behalf of Beverly Hills, Culver City, and West Hollywood. And we see the specific city allocations here on the table. Again, in terms of thinking about the statement of work, if we go to the next slide. For fiscal year 2026-2027, WSCOG staff has met with all of the cities, and all cities have decided to continue funding their programming from last fiscal year. So all cities will continue funding interim housing programs. We have a small description of what those programs specifically are as it relates to each respective city. So again, the same statement of work is going to be sort of transferred to this fiscal year now with this added fiscal year 26-27 budget. Some cities, specifically Beverly Hills and West Hollywood, will be rolling over their fiscal year 25-26 budget into 26-27. Culver City will have expended their budget for fiscal year 25-26, so they won't be rolling over any funds. So we have the columns for what that funds rollovers from 25-26 are, and then what the budgets are for 26-27, and what that grand total is going to be. So again, what we are hoping to do is we're going to replicate the scope of work from fiscal year 25-26, and then just reflect these new grand total amounts, depending on rollovers from each city, as well as the fiscal year 26-27 budget. So with that, I believe that's the last slide. Okay.
Thank you. So we'll take any questions or comments from the board. Happy to start at the end in Santa Monica. Any comments, questions? Thank you. Culver City, Beverly Hills, seeing none. Any remarks from the county? Okay. So I see that we're ready for a vote. Thank you so much for the presentation today. If we have a motion for approval. Thank you. A second. Terrific. Yeah, Beverly Hills, Santa Monica. And so we'll do the same thing, vote by affirmation. Are there any opposition to the vote? Seeing none? Great. We have approval. Thank you. We'll go to action item C, homelessness, La Casa renter protections and homelessness prevention, the Westside COG allocation. I'll turn this back over to staff. And I think Anna, you're on deck again.
Yep. that was good.
Yes. Mhm.
Well,
Thank you. Yes, so this next action item is we hope today to discuss and approve the recommended fiscal year 2026-2027 WSCOG renter protection and homelessness prevention, so RPHP budget, including what we are proposing an allocation for specific RPHP funds to go to La Casa's Renter Aid, which is the integrated service model for homelessness prevention. So if we go to the next slide. So just quickly, similarly to the background on Measure A, some of the funding from that Measure A revenue is also being allocated. 35.75% of that Measure A revenue is being allocated for the LA County Affordable Housing Solutions Agency, so La Casa, to distribute funding for renter protection and homelessness prevention to eligible jurisdictions. And the COG is one of those eligible jurisdictions. So under the fiscal year 2025-2026 program guidelines, eligible jurisdictions were set to spend at least 20% of their RPHP allocation on legal services, inclusive of eviction defense and other legal services, and at least 40% of their RPHP allocation on emergency rental and flexible financial assistance, again, inclusive of financial assistance to household and staff costs. So we go to the next slide. So we submitted the fiscal year 2025-2026 RPHP budget to La Casa, and this was approved on March 24th of 2026. So our total budget totals about 2.2 million. Following a minor modification that we had to the previous version submitted earlier in the process. We submitted one in February, but we did a minor modification. So for this year, the WSCOG board allocated the full amount as pass-through funding to cities. So you'll see here on the table sort of the distribution of funding going towards some of the different activity types eligible under La Casa for RPHP. And I think, like I mentioned, there was 20% minimum required going towards legal services and 40% required towards emergency rental and flexible financial assistance. So we were able to beat both of those two thresholds, as well as just meeting that cap on program administration. But primarily, most of the funding will be going towards legal services and emergency rental flexible financial assistance. Some cities will also be distributing some of those funds to go towards temporary rental assistance as well as short-term income support. So this is a summary across all the cities, but there's more information on the agenda packet. So if we go to the next slide. So like I mentioned, in terms of the approach that we took for the RP budget for fiscal year 25-26, as a COG, all cities decided to pass through all 100% of that 2.23 million allocation to each of the respective cities. Cities are investing this funding in local homelessness prevention programs and partnerships. This approach is allowing cities to continue to fund their existing programs and some of their upcoming programs as well as support their local service providers whom they've been working with to fund some of these in previous years, and as well as just address some of the community needs that are respective to each city. So as we're thinking ahead for fiscal year 26-27, I think there was a new opportunity that has come up, and I think this opportunity is really to the potential of beginning to invest in a more regional coordination approach, specifically through the integrated service model, which is now called Renter Aid, which I'll provide a little bit more information in a bit. So we go to the next slide. So like I mentioned, there's this regional approach coordination to invest in La Casa's integrated service model. This is now called the Renter Aid. So I'll be using it interchangeably during the presentation, just as we get acquainted to the new Renter Aid name, but just providing a little bit of context. What this Renter Aid is meant to be is really an integrated service model that services a county-wide integration of services specifically to emergency rental flexible financial assistance and some of legal services, specifically targeting high risks of evictions. And the Renter Aid is supposed to provide full geographic coverage, so covering all the cities that are under LA County, and really aims to focus on sort of the households who are most at highest risk of homelessness prevention, meeting the renters' need through more accessible creation of an online portal. So this Renter Aid will have an online portal where clients can sort of go into it to apply for emergency flexible financial assistance. And hopefully through this system, they will be creating more timely assistance and deliverable of financial assistance to households, as well as other available resources in partnership with some of the eligible jurisdictions. What this means is that any cities, any eligible jurisdictions that decide to go and use the Renter Aid, they will just be spending less administration time, given that La Casa staff will be sort of handling all of that on their end. And more than anything, it's aimed to just create more shared outcomes throughout the county for more reporting, and they'd be able to improve outcomes across the region. So we go to the next slide. In terms of the timeline of when the Renter Aid is supposed to roll out, I know La Casa has a tentative timeline here of having a soft launch between July and December 2026, where we anticipate maybe a few eligible jurisdictions to sort of join on a sort of pilot version of the rollout, with expansion happening in early of January 2027, and then just a full implementation where all eligible jurisdictions, should they decide to opt in, can fully integrate and fully have a running version of the Renter Aid between January and July of 2027. So we go to the next slide. In terms of some of the specific benefits, in terms of joining the Renter Aid, again, La Casa would be taking on a lot of the administrative portion of running the emergency rental flexible financial assistance and sort of the administration coordination, as well as sort of some of the reporting. So that would mean that eligible jurisdictions who decide to opt in will sort of have that be a reduction in some of those administrative costs, as well as just being able to focus more on just direct household assistance. And so making with this online portal, the hope is to also make it more accessible to more folks across the county. And again, La Casa will just take on responsibility for contract and performance management, which would be a reduction for any eligible jurisdictions to not have to do that. In terms of expected results of fully joining the ISM, and what really this means is that with fully joining the Renter Aid ISM means that each eligible jurisdictions would be giving at least 40% of their RPHP funding, given that that's the minimum for emergency rental flexible financial assistance, to go towards the Renter Aid. So specifically for the West Side, we see a potential of additional 42 households being able to be served through opting into this renter aid. So we go to the next slide. So in terms of finalizing the fiscal year 2026-2027 RP budget for the WSCOG, La Casa Board set to approve the RP-HP program guidelines yesterday, April 15th. We are presenting our budget approach to the board today. And depending on what we vote on today, we're hoping that we'll take sort of the next month or so to work with each of the cities to finalize the RP-HP budget so that we can finalize and submit those budgets before the due date on June 15th. But we'll be coming back to the board to present those more detailed budgets on the June 11th meeting. So we go to the next slide. So in terms of how we approached what we wanted to do with the budget for fiscal year 26-27, there was a few meetings that our WSCOG staff did with each respective city, and there were a few takeaways that we sort of generally heard. Cities generally expressed interest in supporting the renter aid, and as well as a desire to maintain some funding for local programming. There was some concerns about, committing large amounts of funding before the renter aid is fully operational, but there was interest in creating some sort of balanced approach. So taking all of this information in from our conversations with the city, we decided to create a hybrid strategy which allows cities to support regional coordination while maintaining local funding. So we go to the next slide. So what we decided to do was that we presented several allocation scenarios that explored this hybrid approach where we would distribute some funding as a regional COG to the renter aid, and then the rest would be distributed as pass-through funding to the city. So what the cities agreed on was, if we go to the next slide, can we go to the next slide? And we agreed to do 10% of our budget allocation to go to the renter aid and the remaining to the pass-through funding. So this table here shows what those distribution amounts would be. So the 211 would go to renter aid and the remaining go to city pass-through. I just want to reiterate that the city pass-through, each of these cities can also decide to allocate more funding to the renter aid. So with that, I'll open it up for questions or comments.
Thank you. This is really exciting. I'm thrilled to hear that the discussion got us closer towards some buy-in to this integrated service model. I really believe in renter aid and believe it's going to be a transformation for the county as a whole, and certainly understand that because of the level of investment our cities on the west side have made into program delivery to date, there's some tension in how we move forward in this moment. I think we've struck a really meaningful balance. And I just want to also name, maybe because of the perspective I have, seeing other COGs operate around legal services, that we've made a commitment above and beyond that threshold, I think is especially meaningful. We know how important legal services are towards protecting people from falling into homelessness, and that we've made that 33% investment, I think is certainly meaningful. I'm going to open it up for any questions or comments from this board, and then we'll turn it to public comment, seeing as we're a little behind on our agenda. Any comments or questions here? Okay.
Thank you so much for the presentation. Is a point that once the ISM is fully up and running, that the cities would make 100% contribution or whatever we decide at that time, and then the county would La Casa would take care of all these services rather than from the individual cities?
So I can take this question first. So our understanding is what we're recommending today is essentially us dipping our toes into the ISM, putting just 10% of the funds into that system so that we can evaluate it and test it and, participate in its development while still making sure that most of our funds can go to the programs that the cities already are running and already have up and running. But as far as the long-term goal, I mean, it's ultimately up to you all, and it's something that we'll take back to you with frequent updates every board meeting around how the rollout is going. And then when we are here this time next year, we can recommend, some other allocation. Maybe it's 40%, maybe it's 0%. We don't really know. We're going to wait and see and participate in the process.
Okay, thank you.
Any other questions or comments, or are we ready to see if there's public comment on this item? And seeing none signed up before, we are ready for a vote. Do you have a motion on the floor? In a second. Thank you, Beverly Hills and Santa Monica. And are there any opposition to the vote? Seeing none, this motion is approved. Thank you all so much. We'll go to item D, the transportation update, Metro West Side Service Council appointment. Turn this over to Cecilia.
Yeah, I swear we do this every month, but it's not
sure do.
true. So we have 3 appointments to the West Side Service Council, and we have one that's coming expiring. Sorry, let's just find the notes on this. Yeah, so we have. Sorry, I'm in the wrong page. Okay, here we
David
go.
Feinberg.
Yep, found it. David Feinberg's term is set to expire on June 30th, 2026. On February 23rd, we issued a staff call to see if anybody else would like to serve or anybody would like to serve. It's a 3-year term beginning July 1st and ending June 20th, 2029. Just by way of background, our other representatives for the COG are Martha Eros from City of Beverly Hills and our chair, Councilwoman Chelsea Byers. David Feinberg sent us a letter expressing his desire to continue on in this role. We did not receive any other letters, so that is our recommendation to the board, is to approve David Feinberg to continue on as our representative.
Any questions? I don't see David in the room to represent himself. Do we have a motion for approval?
So moved.
All right, motion from Santa Monica and a second from Culver City. Any opposition to David Feinberg's reappointment? Seeing none, thank you, David.
Excellent.
Okay, we'll go to item E, transportation, the West Side Bus Connection. I'm turning it over to staff, and I know we are getting close to our time, so let's see how we can keep moving these items quickly.
We're getting close to our time. This is a meaty presentation. I know Riley's going to go fast, but it is meaty. So let's roll through it.
Yeah, so please go into the next slide. This is a 4-part action item. And so what we're proposing here, essentially what we've reached is a really important milestone where we have preliminary 10% conceptual designs, many of which are in your packet, some other that are up for consideration I'll talk about today. But essentially we're proposing that we really focus on the top priority segments and remove some of the others from design consideration that either have some major challenges or do not have the kind of core sub-regional and transportation benefits that we're all aiming for. So the first part of the action is to remove from future lane reconfiguration. So there would be no consideration of a full a bus lane or even a peak hour bus lane from these segments. They'd still have the option for signal improvements or other kind of tactical intersection improvements. But these are Westchester, Sepulveda, so the southern end of the network next to LAX. We heard from LAX staff, they were concerned about potential conflicts with their projects. We're recommending removing those. We're also recommending the removal of most of Jefferson Boulevard from the that type of restriping, and that's more a technical recommendation. And then we're also recommending removing from the entire project moving forward, the entire segment within the city of Santa Monica. And that's not because we don't think it's important. We actually think it's very important. So does the city of Santa Monica, and they want to fold it into their Santa Monica Boulevard multimodal study and design and essentially take on that that project themselves, kind of bring it in-house, hire another consultant team to do something a bit larger scale, but with support from the COG. And so on the next slide, you'll see a bit more about what that support looks like. We are recommending that the COG program the rest of its Metro Sub-Regional Equity Program funds to complete this project. And we're also recommending distributing those funds in a way that helps complete the project. Up to $600,000 to Santa Monica for completing that portion of Santa Monica Boulevard that I just mentioned. Up to $200,000 for the city of LA because they, as you all know, we're all in tough budget situations. They are in major budget crisis, and frankly, they've said they can't move forward with the segments within the city of LA unless they have some funds to support their design review. So it's up to $200,000 for city of LA design review, and then the remaining funds to distribute to consultants and member jurisdictions as needed to complete this project. So a lot has happened, of course, to lead up to those actions. I want to walk through really quickly community engagement. So we had our first round of community engagement sessions where community members were able to get a preview of the design concepts and a preview of some sample designs and existing conditions. We also received a lot of community emails, including a lot of support for the project overall, but a lot of folks wanting us to do more virtual engagement options, more multimodal improvements, including trying to fit bike lanes into these designs, another bike infrastructure in the designs. And then in that time since, the consultant team has since finalized the existing conditions memo, as you see on the next slide, and 10% design concepts. So what you have in your packet are just a snapshot of each of these. The full existing conditions memo is on the website. The design concepts are also snapshots at this point. They are kind of samples of each segment. And I do want to take a moment to also walk through on the next slide a bit about why we're getting to the point of prioritizing specific segments. It's really, we have limited funding, we have limited time. For us to get these designs shovel ready by the end of this year, or frankly, even early next year, we really need to focus on a couple of the core segments. And so our recommendation to the consultant has also been to really prioritize the north part of Sepulveda Boulevard, the north part of La Cienega Boulevard, because those two segments benefit all 6 of the COG member jurisdictions. Santa Monica aside, kind of doing their own thing. All 5 member jurisdictions aside from Santa Monica have either bus service or direct jurisdiction over those segments. So I want to take one moment. I'm going to make this as quick as possible to just explain what these design sheets look like. On the next slide, each sheet, it has a segment and it has a sheet. And that little box, sheet 303, that is the design for the entire segment. So we've heard some questions, why is my intersection not in the designs? It is in the designs. It's just represented by a different design. And so if you go on to the next slide, you'll see a bit of what that looks like. That's segment 4 I was just talking about, the Sepulveda, right around the Expo Sepulveda E-Line station. The proposal there, for example, is swapping out a general purpose lane for a dedicated bus lane. But we're looking at other options as well. We're looking at peak hour bus lanes on the next slide. We're looking at various other alternatives, including alternatives with bike lanes. So if we go on to the next slide, you can see a bit more, sorry, one more slide. On La Cienega, there's a similar story where if we're looking in the Beverly Hills, City of LA region, there's a potential for swapping out a general purpose lane for a bus lane all day, or on the next slide, just in the peak hour, and that would be right around the new D-line extension that's opening up. Similarly, if we go on to the next slide, West Hollywood segment of La Cienega, a bit more north, it's a bit more constrained. This really speaks to how constrained this corridor is. But the consultant team is still looking at 4 different alternatives for that segment. So we won't go through all of them, but if you go through the next 3 slides, you'll also see an example of the southern part of Jefferson and Culver City, where we have an example of where we're able to fit, into the space just a southbound bus lane. So some of these, it's very, very tactical, very, strategic interventions that focus on very specific locations where the bus gets stuck in traffic for 5 minutes at a time, and we can speed that up to maybe 1 or 2 minutes. On the next slide, we can also see an example of where our designs do incorporate protected bike lanes. It actually adds protection alongside the bus lane, some plastic bollards that could go in there. So on the next slide, you'll see there's a lot more information on our website now. I know this is a lot of information, a lot of work that's been done. The next slide, I think we've kind of discussed this already. Santa Monica really taking the lead on trying to move this project forward. And City of LA, I think we are taking the lead to move the project forward with them and really showing that, we can have this multi-city partnership. The next slide, really is just what I mentioned. The board, you all on the board previously authorized a $1.3 million. So that's why there's the 2.6 million and the 4 million. The reason those numbers are different is there was already a $1.3 million authorization. Next steps, we don't have to really go into. there's a map as well. It's two more slides. This is a visualization we could talk about, but I think we want to just get to the action at this point and any questions that folks have, because I'm sure there are questions. I know there will probably be some public comments, so I'll stop there.
Thank you. I will see first if there's any questions from this board. We do have a number of public comments if we want to jump there instead. One comment from Santa Monica.
There we go. I thank you, Director O'Brien, for your presentation and for doing it speedily. Could you explain a little bit more about our relationship with the City of Los Angeles and the funding that we're proposing for them versus covering it within their own operating budget?
So I think we all recognize that each member city that is here today, as well as the county, have put staff resources into this project. And City of LA has put a lot of staff resources. So LADOT staff, as well as staff from Council District 5, District 11, District 10, they've all participated in this process so far, and they've put a lot of their own staff time in. So we're really grateful for that. But what they've told us is that essentially the LADOT design team is severely understaffed, severely constrained. They have a lot of other priorities throughout the city of Los Angeles, including San Fernando Valley, South LA, Northeast LA, everywhere in the city of Los Angeles where they're also trying to do these types of projects. And what we've concluded in conversations with them is that they need a push from us to actually prioritize these West Side corridors. And many of these corridors, for example, La Cienega Boulevard, just a few feet away from here, it kind of zigzags. If you look at the map, it actually goes between West Hollywood on one block to Los Angeles on the next, back to West Hollywood on the next block. So it's really impossible for West Hollywood to move that segment forward without the participation of Los Angeles. Similarly, Culver City bus, Line 6, Culver City's most used bus route along Sepulveda Boulevard. They lose hours and dollars sitting in traffic within the city of Los Angeles. So Culver City has an incentive to move these corridors forward. I mean, there's even a part of Santa Monica Boulevard in the city of LA where Big Blue Bus gets stuck in traffic there. So that's where we're going for.
They won't review the plans without money. And so we're negotiating a lower rate. We've been working with their senior staff, and we're also going to have a conversation with the mayor's office later this afternoon. But the reality is they won't review the plans, and then none of these projects can go forward without the city of Los Angeles reviewing those plans. So that's the reality of it, just to cut to the chase.
$200,000 workaround. Thank you for your creativity.
Yeah, thank you. And just last question, when was the last time a representative from the city of Los Angeles, either from the mayor's office or CD5 or CD11, have participated in a West Side COG meeting?
They often send representatives from the staff. In terms of the board members, it's been quite a while.
Okay, thank you.
Yeah, it's probably several years.
Any other questions or comments before we turn it over to members of the public? Okay, I know we have Kevin Burton. Please join us at the front. The microphone is over our left shoulder board so we can.
Kevin Burton. I live in West Hollywood and am a strong supporter of this project. So I thank COG staff for working on this. I guess just a few comments. One, it would be helpful if the city of Los Angeles would start sending representatives to this meeting so they could speak for themselves rather than relying on staff. Two, it's a little surprising, this sudden removal of about a third of the whole La Cienega route from consideration through the city of Culver City going down to Sepulveda Boulevard from Obama. I understand the need for speed, and I appreciate the timeline, which is very rapid, I think, to have a final proposal by the end of the year. That is great. It's faster than I expected. So it might be possible to consider splitting the project up into earlier and later phases. Metro does this with their subway building, for example. I don't know if financing would allow that. My final comment is that it would be helpful for the public, and I think for the member cities of the COG, to follow this interjurisdictional project if there would be a report from every city to the COG, perhaps twice a year, on what your city's progress is in implementing these plans once it's finally approved. I know at least one of your cities has already held public meetings discussing details of the routing, and it would be helpful to have a similar report on that from every city going forward. Thank you.
Thank you. I saw another member of the public, I think, raise their hand in the Zoom. Was it Barbara? Did I catch that?
Yes, we have one online comment, Barbara. Barbara, go. We can speak now.
Thank you very much. I am a member of the West Side Neighborhood Council, and I serve on the West Side Regional Alliance of Councils Transportation Committee that met last night. And we're very concerned because there has not been adequate outreach to our area. And our area includes Santa Monica Boulevard and Sepulveda Boulevard. As you all know, the Olympic Village will be in UCLA. And the Olympics people have not yet announced their plans for the dedicated bus lanes that they will be establishing to move athletes, staff, and associated VIPs during the Olympics. And that may also affect some of these streets. The two outreach meetings that were held on this were held in West Hollywood on a rush hour weekday night and in Culver City on a Saturday morning. I attended the Saturday morning meeting. It was incredibly poorly attended, although that meant lots of donuts for those who did come. It is not ready. And we're very concerned that a program that is being expedited for the Olympics or in association with Olympics with the intention of being permanent needs much more outreach and much more robust outreach. And I did express that to Riley. So there are a number of concerns we have. We went through a multi-year Santa Monica Boulevard multimodal construction project, which at the time was the largest such project in the county, over $90 million. And we addressed a lot of the issues that we thought were current at that time. And there has not been adequate outreach or engagement with our communities. Thank you.
Seeing no other members of the public signed up to speak, are there any other final comments or questions from this board before we take recommended actions, all four of them? Okay, seeing none, we'll take a motion for approval. Do we have a second?
Second.
Great. Any opposition to the vote? All in favor? Terrific. So that was our final action item. I know that we are close to our 3-minute closing time now, but that was our final action item. So if there are members of this board who need to leave, that is okay, because we do not need to hold quorum in order to take any action today. We do have a number of reports. It's looking about another 26 minutes as scheduled on the agenda. So I trust people who are delivering these updates that are non-voting or action-oriented updates can move more accelerated through those updates. So we'll go into item 5, the Regional Housing Trust Fund implementation update. And I think we're turning this over to the project team at Harrison Associates.
Yes.
Thank you. Thank you.
Good afternoon, board members. My name is Dima Galkin. I'm a director of community development and housing at Harrison Associates. And our team, together with Civic Home, Community Planning Collaborative, and a team of fundraising specialists, is working on the Affordable Housing Trust Formation Project for the West Side cities. Next slide. Actually, one more slide. And next slide. So our housing trust, generally speaking, is an entity that provides funding to finance the preservation and production of affordable housing. It can be established by a state, a city, or county governments as a joint powers authority or as a nonprofit 501c3 organization. And funding sources generally include government, bond and tax measures, private donations, and philanthropy. Senate Bill 20, which was signed by the governor in 2023, provides parameters for jurisdictions to form a joint powers authority-based housing trust. And that is the current plan is to propose a housing trust formed under that Senate bill. Some of the capacity that a regional housing trust provides are to help cities to address their growing housing responsibilities with limited staff and resources. We know that the arena for the 4 cities considering the housing trust is more than 19,000, with more than 9,600 of those being lower income units. Housing Trust creates shared capacity and expertise. It also provides regional coordination that can attract and leverage more funding, and it does maintain local control at the city level. Next slide, please. Some of the key funding sources here, Measure A, which was discussed previously in the meeting, is the half-cent sales tax measure. About 36% is allocated to La Casa, who must pass 70% of that funding to eligible jurisdictions, in this case, the West Side Cities COG. I'll get into that a little bit more on the next slide. Another item to highlight here is that with certain state programs, LHTF in particular, emphasis is placed on regional collaboration among housing trusts representing multiple cities. Also with state and federal budget allocations, as well as with philanthropic funding, we often see that it's easier to allocate funding to a region rather than to a local city, given regional representation. And then certain sources like PLHA sometimes can be too small for one city to have a significant impact with only its allocated funding, and so it can help to pool funding together for larger projects. Next slide, please. Going into Measure A a little bit more, approximately 7 million is estimated for the West Side cities. Approximately 4.5 million of that must be spent on production, preservation, and ownership programs. This portion could be administered by the proposed regional housing trust, whereas the renter protection and homeless prevention and technical assistance could continue to be managed by the COG, who has allocated to the member cities to supplement their programs. Next slide. Some of the key programs that housing trusts can include, it often depends upon the needs of the region, available funding, and the restrictions and requirements of that funding, but it can include a variety of product types and financing types, both rental and ownership, short and long-term financing, and various population groups. Some of the key benefits are that regional housing trusts provide a larger scale of operation than individual cities operating independently. There's expertise from the housing trust and staffing and otherwise. There's efficiency in having a regional entity. From our experience with other regional housing trusts, we've also seen more capacity to advocate at the state and federal levels. And each participating city shares in the success of the other cities, helping to build momentum for further success. And even with the regional housing trust, individual cities can maintain their independent housing activities and even separate housing trusts. Next slide. These are some options for the administrative structure of the regional housing trust. We included no regional housing trust as an option here, and an asterisk there on the low administrative cost. That's a low cost for the regional housing trust, but the individual member cities would still be responsible for their own costs, and you wouldn't get the benefit of having that regional collaboration and what I presented earlier. Just really quickly going through this, we do maintain a local control in all of these scenarios. And so in terms of awarding funding, each participating member city would be able to approve a project before it gets recommended for funding. Again, yeah, to keep it brief, I'll keep going. And then that brings us to the formation process. The staff report and resolution are part of the procedure for the formation. At the June meeting, the COG board will take up this matter in the form of an approval to recommend. But the core is the city councils, which will be considering this item in the coming months specifically to form a regional housing trust. Just a couple of quick highlights here. The JPA, or Joint Powers Authority Agreement, will provide the legal structure of the housing trust, and the bylaws will specify the processes for the trust to follow. In addition to the items listed there, these documents will generally address the governance, the voting structure, and the funding authority. As part of our work, we're also conducting stakeholder and public outreach. I want to thank all of the representatives here who participated in that stakeholder outreach. We're also doing a housing needs assessment, preparing a fundraising strategy, and preparing a strategic plan that incorporates these elements.
That was pretty fast. Any comments or questions with this brief informational update? Okay, thank you. Very exciting stuff. June will be a great meeting. We'll go to item 6, or transportation update.
Yes.
Microphone, sorry.
Just celebrate the locally preferred alternative getting adopted on the K line. Big deal. We really should acknowledge it. I won't take a lot of time. That's it, but it's important to know. Next on is Metro staff's going to talk about Metro Board Composition Committee. As you know, with Measure G passing, there's discussion about the changing composition of the Metro Board to accommodate additional members of the Board of Supervisors. So Good to see you. All right, can I give it a go?
Just sliding the chair over. I love this.
Okay, that'll work.
I don't know where this came from, but it's really great.
Yes, no, I'm going to do the speed version. Hi, everybody. Karen Swift, Deputy Executive Officer for Local Government Relations at LA Metro. Thank you so much to the COG, the chair, and all of you for making time. This will be the speed version. So do you have the deck? Do you have our deck? There we go. Okay, so we'll go very quickly here. So as you may know, we're doing a sort of a quick outreach these few months on the board ad hoc, sort of a board composition listening session. So this is really going to be an invitation to participate. Next slide. I think you all are familiar with Metro. I'm going to skip that one. I got that down. So there's a little bit of history on how LA Metro came to be. If you don't know, we were created back in 1993 when RTD and LA County Transportation Commission merged. And then through our history, we've had different types of governance, really, sometimes appointed by the governor, sometimes a mix, sometimes all elected. And that gets us to where we are today, a mix of elected and appointed. Next slide. So it was AB 152. Richard Katz was the state law that created Metro, and that includes details on when and how our board could be changed. And there are two triggers really to change that baked into the legislation. One relates to City of Los Angeles population targets, and the other is why I'm here today, the LA County Board of Supervisors expansion, which requires Metro to submit a revised board composition plan to the state legislature within 60 days. Next slide. So Measure G, I'm sure everyone here is familiar. Back in November 2024, the voters approved amendments to the LA County Charter that initiates a new process. Measure G in and of itself does not change the Metro board, but it does require us to begin now with a thoughtful listening process. Next slide. So back in January, our current chair, Fernando Dutra, established an ad hoc committee and directed staff to conduct some thoughtful outreach to the community. Our ad hoc committee members include representatives from the current board, business, labor, the Council of Governments, county's government reform task force, and a transit rider. Next slide. So familiar, here we go. Here's the current Metro board. I'm not going to read this, but you all can see our current board makeup. So again, it's mostly elected officials with one non-voting appointee from Governor Newsom, Gloria Roberts, District Director, Caltrans, District 7. Next slide. So again, I think everyone here familiar with that Metro Board of Directors responsibilities, but a lot of big things, right? Set the agency, the budget, the policy, our labor agreements, appoint and oversee our CEO, and spend a lot of time doing a lot of things with Metro staff. So it is a big job and important that we have a thoughtfully composed board. Next slide. I'm going to skip this one. If you like demographic wonky stuff, I'm happy to talk to you afterwards, but we'll keep moving forward. So we did one of the things the ad hoc committee directed Metro staff to do was to conduct a review of our peer agencies, really take a look around the country at how other large transit agencies are formed. We're the third largest transit agency in the country right now, but serve a large group. So you can see here that pie chart on the right is what I'll draw your attention to, where we really have some balance that's different as you look across the country and see, for instance, Philadelphia or Boston, the role of the governor in some of those transit agencies about how they get mostly appointed rather than sort of having elected. So we're pretty much on par, but, just good to do that analysis. Next slide. So we do have a survey that I think we've given to you, Riley, so we can pass those out to you if you'd like to take it. This is what we've been taking around the county, asking folks, so trying to sort of understand, are we talking to transit riders? That's something we know is important. How familiar with most people about the Metro board, the fact we had a board or how it was structured? I'm going to guess you all probably a little ahead of the curve, but it's a lot to explain. And then really once people understand it, how well do they think the current Metro board reflects individual community needs? Next slide. And then we also are looking for, sort of priority factors, values and things that are important that allow us to give guidance back to our ad hoc committee on what we heard. Next slide. So we've been conducting listening sessions. So those of you who sit on the Service Council have already seen us come through, but we have 2 more hybrid and virtual opportunities coming up, and I invite you to join us. Next Wednesday, we've got a hybrid meeting for our Community Advisory Council. That's downtown at our Gateway headquarters, but again, you can dial in. And then our virtual listening session will be Wednesday, May 6th, hosted by our ad hoc chair, Glendale Mayor Ara Najarian will be hosting that one. And we've got a QR code there, and we think we've got some fact sheets we brought along today as well. So invite you to join us, and we'll be collecting all of this feedback through June 1st. Over the coming month, we'll be really transitioning to more tabling opportunities. We'll be going out to some of our heaviest transit stations, engaging with folks there, trying to meet the community where they are, rather than expecting them to come to us. I think that may be our last slide. Here we go. Okay.
Thank you.
Questions? Good.
Any questions? Fill out your surveys, get the word out. Thank you so much, Karen. All right. I just want to also say at the transportation update related to the K line, a huge thank you to the WSCCOG and the staff, especially for helping in that final push. Letters were sent, advocacy was done, showing up at the meetings, much appreciated. All right. Item 7, Executive Director's Report.
We're going to roll really fast. Thank you, everybody, for getting your Form 700s in. Yay. Also, La Casa announced its first round awards. The 4 projects that we allocated our funds to did not win in this first round, but there's a second round that's going to get announced at the end of April. So we're excited about that. And lastly, just as an FYI, this summer, La Casa is probably going to release a $15 million NOFA for community land trusts and naturally occurring affordable housing. We'll know more in June. This is a really exciting opportunity for the West Side. That's it.
Item 8, legislation. I'll pass it over to Jeff Kiernan, rep from Cal Cities.
Thank you, everyone. Just a really quick update from to highlight, well, not from my written report. There's a lot of new updates. We have submitted a lot of new letters on SB 79 cleanup legislation from last year, including a Metro-sponsored bill, SB 1361, which would delay that, excuse me, not delay, but would, unless you have trains actually running on your tracks or bus lanes in use currently, those would not be implemented on to SB 79. So future rail stops, future bus lanes, because Metro is finding that a lot of pushback from cities that have these in the future. So they wanted to run this bill to help alleviate some of that concern. And those are all support if amended. One of the biggest amendments that we're seeking on all of the SB 79 legislation is to delay it until the 7th RENA cycle in order to allow us to fully integrate these plans into our housing elements. AB 1383, not one that I've raised with council members, but only to city staff right at the moment. But this is going to roll back some of those pension reforms for public safety officials or officers that took place a number of years ago, lowering the retirement age and also increasing some of the percentages that these pensioners can receive. It's going to obviously increase a lot of costs to cities. So we are opposing that bill and wanted to make sure that folks are aware of it, that that's going on. Another big bill that certainly I'm working on, AB 2714 by Assemblymember Mirat-Suchi. If you have a overlay in your housing element, the city of Redondo Beach had their housing element struck down because of an overlay, even though that was the direction from HCD. So we are trying to go back with Assemblymember Mirat-Suchi to prevent other cities from having the same problem that HCD didn't recognize was a problem within the law, but the courts have now said it's a problem. I know that at least half of my South Bay cities have this issue within their housing elements. So I'm sure it is a much more common thing across the state. And we're trying to work on this not only for future housing elements, but also trying to retroactively save City of Redondo and others from those problems, because this City of Redondo Beach already has 3 builders element remedy projects that have been submitted since the courts decertified their housing element. So it's a big issue for many of our cities. Please. Yes. Yes, and I don't necessarily know which cities have an overlay. I'm just sort of assuming that it's very common out there since I've now talked to my South Bay cities a lot. Proposition 36, there's a budget hearing going on right now in Sacramento related to Proposition 36 and funding Proposition 36. This was the retail theft and other public safety measure that we passed 2 years ago that was not funded in last year's budget. We're asking the legislature to fund that this coming fiscal year with $400 million. It's not a whole heck of a lot of money, but we're hoping we can get that added into the budget. I want to mention two other things quickly. Last year, SB 827 now requires that city officials in department heads, committee members, commission members, city council members, and mayors all have to participate in a required financial training every 2 years. For those officials who started this year in 2026, they have got to complete that training by July. And anyone else who is employed and a member of a city before that, they have the full 2 years. So Cal Cities is working to bring that training to our city members and make sure that we can start to implement those processes. We're going to do one virtual one on May the 29th, and then at least 2 more throughout the course of the year, including an in-person one at our annual conference. So I wanted to make mention of that because you may not be aware that this is a new requirement. Oh, and then lastly, just quickly, the Cal Cities State Board as well as the LA County Division Boards are both seeking applicants right at the moment. The deadline to join or to apply to join the Cal Cities Board is April 22nd, and the LA County Division deadline is May the 1st. So please let me know if you have any questions after this. Thank you.
Thank you. So we'll move on to item 9, announcements. Any announcements from this board? Seeing none. Oh, go ahead.
Just want to say that the Move Culver City, the eastern segment extension, is almost complete, and that was funded by Measure M funding. So if you don't know, that's going to extend it out to Fairfax and La Cienega. So just want to give a shout out to that.
Thanks. Any other comments, questions? I just want to give a shout out to Estelano Advisors. I know you're celebrating 15 years of
thanks.
the firm. Yeah, congratulations. Thank you for your service to this COG. Really appreciate you and your leadership in the region. We have our next meeting set for Beverly Hills. Thank you for hosting us. Thursday, June 11th. We'll see you all there. I'm going to pause now to take any final public comments from the audience. Please come up to the microphone if you have a final remark. And if there's anybody online, I see Barbara raised her hand again too. We'll come to you right after, Barbara. Please go ahead.
Sure. I'm going to make it very quick. My name is Mackenzie Neely Wright. I do external and legislative affairs at AT&T. I represent several of the cities here, including Culver City, Beverly Hills, and Santa Monica, West Hollywood. I can support you, but I would take the information and then pass it along to the right person. So if you have constituent complaints or any questions related to AT&T, I'll share my contact with you so you can just be in contact. I had other things, but we're over time, so just want to be respectful. Thanks.
Thank you. Appreciate that, Mackenzie. Barbara, we're coming to you. Barbara, can you hear us?
Thank you. Thank you. Barbara Brody here. A quick legislative question. We know that the RENA goals were set at a time that was very different than today in terms of cost of construction, labor availability, interest rates, insurance, on and on and on. While we won't be successful in challenging RENA numbers, what I'm wondering is whether there's a legislative approach to request that builders remedy be placed on a moratorium in this current housing element cycle. The goals were set during COVID. Nobody knew what its impact would be. Plus, we've had fires and all kinds of changes meaning that the goals were set in a different reality. And to punish cities with builders remedy because of the inability to reach goals that are probably unreachable seems to be a cruel thing. So I'm just wondering if legislatively the COG would want to consider working with our representatives and other cities to seek a way to ask that a moratorium on the implementation of builders remedy be implemented for the current housing element cycle. Thank you.
Thank you. And we're unable to respond as a question, so we'll take your question as a comment today and note it in the record. And we do have, We have one other member who's going to speak. Please go ahead, Eric.
Thank you, Chair Byers. Eric Rodriguez, LA County Government Affairs Officer for SCAG. I do have an update on SB 79. We're actively developing those maps and zones. We recently received some official guidance from HCD on March 20th. We're going to begin working on those with those guidances. We're also expecting to host an informational session for impacted jurisdictions, just impacted jurisdictions, and transit operators within LA County in, I think, late spring. We don't have an official date yet, but that may be maybe early May. And before we finalize those, we will be bringing those SB 79 maps before the regional council in June. So take a look at that. If you have interest, let me know. I can share those dates once those are finalized. Thank you.
Thank you, Troy Rep at SCAG. Any final comments in the room today? We really squeezed it out. Thank you all so much. Really full meeting. I appreciate you all navigating the tech challenges and hanging through this one. We'll adjourn the meeting at 1:34 and see you all in Beverly Hills in 2 months. Enjoy the rest of spring.
Thank you all.
That's the Metro composition survey. If you want to fill it out, or on the back is more important. The QR.